As many as 450,000 Americans have become allergic to red meat since 2010. Now, this is because of an illness triggered by tick bites. And some researchers warn of this particular tick potentially moving north of the border. Alpha-Gal syndrome occurs when an infected person eats beef, pork, venison, or other meat from mammals or ingests milk, gelatin, or other mammal products. When a sugar that's in meat from mammals and in tick spit enters the body through the skin, it triggers an immune response and can lead to a severe allergic reaction. Doctors recommend people with the allergy should change their diet, carry epinephrine, and avoid tick bites. Well, joining us now to give us more insight into alpha-Gal syndrome in our weekly medical segment is Dr. Abhishek Raut, Medical Director at Appletree Medical Group. Dr. Raut, welcome back to Forum Daily.
Great, thanks for having me.
Quite the interesting syndrome here, Dr. Raut. So what exactly is alpha-Gal syndrome, and how exactly does it affect the body's ability to digest red meat? Can you walk us through the science here?
Right, so alpha-Gal syndrome is very unique. It's a condition that arises from an immune response triggered by tick bites. So a person is bitten by an infected Lone Star tick. That tick produces a sugar molecule called alpha-Gal into the bloodstream. That sugar is also found in red meat, such as beef, pork, and venison. And so the body creates a sensitization response to this sugar. And once sensitized, the individual's immune response is to produce antibodies against the sugar. So once you have those antibodies, whenever you consume meat that does have that sugar, the body regards it as foreign and really launches an allergic response, so releasing histamines and other inflammatory molecules, leading to the symptoms of an allergic response.
And it seems this allergic response could be quite severe, Dr. Raut. We know that some doctors are suggesting that those who are allergic carry epinephrine. So do we know if anyone has died from this type of allergic reaction?
Right. So with a classic allergic response, you'll see itching, hives, swelling of the face, lips, tongue, and throat. But more severe responses, you would see drops in blood pressure, difficulty breathing, and even loss of consciousness. So yes, in severe cases, alpha-Gal syndrome can cause this anaphylaxis response. And that's why it's important to have that epinephrine handy, because if you do have that response, at least it will buy time for medical assistance for the allergic response.
Now, it seems that this sort of allergic reaction is similar to other allergic reactions that we've seen. So what are some telltale symptoms of alpha-Gal syndrome itself?
Right. So very telltale symptoms will manifest typically a few hours after consuming red meat or other mammalian products. You're going to get that itching, your hives, a little bit of redness on the skin, especially around the mouth and face, and you'll get a bit of swelling as well. You may have some GI symptoms like stomach upsets, nausea, vomiting, and even diarrhea. And then more concerning, you can have respiratory symptoms like difficulty breathing as well.
And is this a permanent condition, Dr. Raut? Is there no treatment for it?
It can be a very long-lasting condition. So most individuals, the allergy will persist over time. There's no definitive cure right now for alpha-Gal. And really, management is all about avoiding consumption of red meat to avoid that allergic response. And we do see that over time, many individuals will actually have a reduction in the sensitivity that they have to the meat.
All right, Dr. Raut. And why just red meat? Why not other forms of meat like chicken and fish?
Yeah, it's very interesting, because what we're seeing here is the alpha-Gal syndrome is specifically because of that sugar molecule, alpha-Gal. And that sugar is actually very uniquely present in mammalian tissue. So red meat, in particular, it is not found in chicken, fish, or other non-mammalian products, which is why when we get that immune response, you're not going to have that response to things like chicken or fish. It's really going to be against red meat.
So what are some protective measures that Canadians can take to prevent any tick bites? Because we know some ticks are associated with Lyme disease. So what can they do to protect themselves?
That's right. So for Canadians, the important thing here is to make sure, if you're going into wooded areas, to be proactive, wear long sleeve shirts and long pants, and tucking those pant legs into the socks or boots to create a barrier against ticks. Wearing insect repellent, and then when you're done the outdoor activity, make sure that you shower promptly to wash off any unattached ticks, and also to perform a tick check on the body after you come back.
All right, Dr. Raut, always a great interview. Thank you again for your time today.
Great. Thanks so much for having me.